All right, 4 o'clock. It is our weekly metrics team. Let's jump right into it. So, and some good news today. Dr. Johnson, is that showing up on your screen?
Not yet.
There we go.
It is
All
now.
right. Got a little delay. Okay, so there is our agenda, normal agenda metrics, then some updates from the health department and our school nurses. So Megan and Wendy were able to track the data as always again this week. And again this week, it's a great sign. So from a peak back early January, we have now even dipped down to the green. We haven't been in the green in a while, and I'll flip over to this one first, then go back to the regular chart. So biweekly case total was down to 29, which is the lowest we've had since October. So that's really, really exciting to see. Test positivity rate down to 4.9. So we have to stay vigilant, but it is good news, and we are heading in a good, positive, I guess, negative direction in a good way. So by county case total 29. Students quarantine, we're down to 52 from 69 the week before. Our staff quarantine went down from 7 to 6, and then we have 0 positive COVID students over the last 2 weeks.
That's so cool.
What a great thing to see. The 0 it's even off the chart below it. So really exciting stuff there. As always, thank you, Megan and Wendy, for getting us these numbers and tracking all this. Any questions on chart trajectory before I turn it over to our friend Katie Plum?
So Dr. Hoff, I did, Megan and Wendy could confirm this, but the Google Doc that Megan and Wendy updated looks like there are, over the last 2 weeks, 0 cases among students and 0 cases amongst staff. Is that accurate, Wendy, Megan? Cool. So we haven't seen that for a really long time either. So that's really good news.
Yeah, lots of, I mean, it's just good numbers, good news. What we had, I think 330 or so ballpark right around there, vaccinations last Friday. So that went fairly smoothly. So yeah, we're in good shape. So with that, I'm going to turn it over to Katie Plum from the Crook County Health Department.
That is, it makes me giddy inside to be sharing this good news. It's huge. Yeah, I want to say it, I want to celebrate it that we're slow in our case investigations, our new cases that are coming in, but the reality is, I'm not jinxing it. It's just, it's slowing down. And that I think is people, it's such a combination of things, right? The weather's getting warmer, people are able to get outside. It certainly helps. People are starting to get vaccinated. People are staying diligent in mask wearing and distancing, and we're keeping our guard up where we need to, certainly. So, and that also is allowing, these cases dropping is allowing our community to open up. We're able to see athletics starting again, our restaurants opening up, and just starting to see things shift towards some semblance of normalcy, which is really, really exciting. And so yes, we're diligently working. I say things have slowed down, but really just in that area, because at least in the health department where we've shifted our energy mostly towards vaccinations. So I mentioned before the call, we're working really hard to expand out our capacity to offer vaccines each week. I know those appointments go really quick in our online system, so we were just talking about how well the pod went on Friday, and some folks did get their first vaccine at the Friday pod. So for folks who are going to be looking at getting their second dose, you'll want to use that online scheduling system to get to one of those clinics as one option. Another option is, well, that's probably the best option, because the health department, the way it works is the state sends us a number of second doses based on how many first doses we distribute. So if you try to go somewhere else for your second dose, they might not have the second doses available. So ideally, look at that online scheduling system for the health department. It is okay. It is definitely okay if you're not able to get in right at that like 28, 30-day window. Your immunity is good beyond that. So keep trying to get in, and we'll keep doing our best to open up spots. We're extending our hours, we're extending the number of people that we're able to put through a pod each day, or clinic each day. So bear with us, please. And for those folks who are looking to get a first dose vaccine, we are working with, we're hoping to start see pharmacies and St. Charles Mosaic Medical is still reaching out to their eligible patients right now. So we're starting to open up additional sites in Crook County that are able to start offering doses. As well as big news last week, the Johnson & Johnson single dose vaccine was approved, and we actually get a shipment next week, as soon as next week. They got them out the door. So we're looking at, and that's a game changer to have a single dose, because we're not looking at juggling second dose appointments. And so we're excited about that too. Yes.
All good information. You got anything else for us?
I was just going to ask if there's questions.
I don't have any questions. Anyone else out there? I think we're seeing head nods. So thank you. Lots of exciting stuff. It's cool to shift from like contact tracing, all your work, to vaccine deployment. So what a fun thing to be a part of. All right, Katie, with that, we're going to turn it over to everyone's favorite part of the meeting, the nurse report. School nurse report. School nurse Wendy and school nurse Megan. What do you guys got for us? Anything, any concerns out there?
I don't have anything, Joel.
What? How are we going to keep this being the people's favorite part if you guys don't have any information? I guess that's good news. I just checked we've got the anonymous COVID concern link. Again, it was completely blank. So yeah. No concerns out there, man. We just gotta stay the course and keep at it. So any final questions out there before it's 4:09. We're getting pretty close to under a 10-minute meeting. Any other questions out there?
So one thing I'll throw out there, because I've seen on social media, a couple of parents have asked the question, geez, cases are coming down. So is the school district going to get rid of the requirement to wear masks anytime soon? My response has sort of been, we're not going down that road until we hear, differently. We're continuing with the mask and other requirements. So just a heads up that might be a question we get asked in the coming weeks if our case counts continue to decline. So I don't know if anybody has an answer. Katie, I don't know if you've heard anything from the state, but that's just something that I suspect we'll need to answer in the coming weeks.
And that's an ODE, that's not a local school district decision. Even if we said, hey, case counts are low, let's not do masks, we wouldn't be able to do that. That's all ODE guidance. So that would have to come from them. So we'll definitely keep watching for that though.
Yeah.
All right. Katie, you got anything else?
Sorry, Joel. I was just going to say on our end, we haven't heard any alluding to that lifting anytime soon, even with.
guys, I think that's a wrap for Tuesday afternoon. So thank you everyone for tuning in.
Great job, team.
We'll see you all next week. Thanks a bunch.